Welcome to the Holistic Dentistry Podcast, the show that gives you the tips and tools to detoxify your mouth for a healthier body.
Welcome to today's show. I'm so excited to have here Dr. Sami. And I do want to tell our listeners a little bit about you because it's pretty incredible, that you're a dual specialist. We don't see many of those in both pediatrics and orthodontics. Which one came first for you?
It was actually a dual specialized program at UCLA, which unfortunately no longer exists. But it's like a 3.5-year program that they had. So you do both of the degrees together, both specialties together simultaneously.
Yeah, but I can only imagine. I've only done one, but I can only imagine two in 3.5 years. And then later
between the departments a lot.
Yeah, exactly. You stayed there as a clinical instructor at UCLA.
Yes.
For both medical and dental program. And it was during that time that you became one of the creators of the Children's Health Advocacy Training curriculum. Chat. Do you want to tell us a little bit about that?
Yes. So I started teaching at UCLA right after I finished residency. I love teaching. So I went into it and everything kind of fell on my lap. Another amazing colleague that was my professor, she went for maternity leave and kind of all of these things fell on my lap, and I started learning a lot about health policy and became a fellow for American Academy of Pediatric Dentistry. And then we started with the pediatricians to kind of shape this health advocacy training, children's health advocacy training, which really looked at a lot of things like breastfeeding and foster homes and nutrition and really looking at children, like what does it mean for them to be healthy, And so we started a lot of different programs inside actually preschools and some in the Venice Medical Clinic. And we would go and see the children all together with medical and dental residents, pediatricians and pediatric dentists. They would see the kids together initially, and then they would learn from one another, and they would learn all aspects of so many different things about kids that normally in the pediatric medicine or pediatric dentistry is not even talked about. So that was and then simultaneously I was teaching at the craniofacial clinic at UCLA, where the patient comes and each practitioners from all kinds of different specialty, they all evaluate the patient one by one. And then at the end of the day, they all get together around a round table and they start talking about, like, this is my perspective. This is what I saw. This is what I saw. So I started asking the question, why don't we look at other children like that? Like, why are we such a disintegrated kind of I'll just send them to you and I don't really know what you're doing, but, you're perio, so you would know how to take care of it. But not really understanding the collaboration, not really understanding what you can do for a patient, and not even knowing half of the time, like, that I can send them to you or to somebody else. So I think that that discussion and that conversation kind of intrigued something in my consciousness, that we are looking at children, especially as a disintegrated pieces of organs or different things. That's like, oh, there's the eye, there's the nose, there's the mouth, there's the teeth, there's the TMJ even, it's like most orthodontists, they don't even think that the TMJ is their business, if they're putting all of these appliances in the mouth and it's actually injuring and compromising the TMJ. They're like, no, that's not my business. That's not my problem. Send them to somebody else. And so I think that when I decided to leave UCLA and kind of come into the private practice, I wanted to see how can I see every single child as a whole and evaluate them from not just physical. Also, I have a degree in a bachelor and a master in psychology. So also look at like the integrations of their home psychosocial aspects, the relationship between the parents, like how is the home life? How is the mom's trauma, and So I was really interested in all of these things. So I started, doing what I love, and it just kind of turned into this magnificent,
Yes.
purposeful life that I look at and evaluate every child with the wholeness of their being, rather than what's missing or and I think their teeth is like the last thing, actually, when it comes to all that. Not a last thing, but a way of, like, if there is something on the teeth, it's also a manifestations of everything else that is going on inside the body. So how
I
can I look
agree.
at the whole aspects of these things?
Yeah, I agree with you. That's the way I look at the mouth. If something's going on in the mouth, whether it's a stagnation that's manifesting in a chronic inflammation or infection, there's usually a problem elsewhere in the body
Right.
also. It's not just the teeth. And it's really incredible that you were able to practice that way, even at the Venice Clinic, to work with pediatricians,
Mm-hmm.
because I think that's also needed in adult dentistry as well. For
Right.
us to be able to, let's say, as a periodontist, I would love to spend more time with cardiologists
Yeah.
to learn about the effects of the mouth, on the heart, and to looking at EKGs and things like that. So hopefully that's coming. I think that's a brilliant thing that you did with the chat curriculum
Thank
there.
you.
But another thing that's special about you is that, at your office, you like to create this healing environment of customized care where education for families is a priority as well. You understand that basically learning and healing only happens when your patients are supported by a nurturing sense of compassion. And you like to get the whole family involved, which is
Yeah.
so important, I think, in every aspect of healing,
Right.
but especially so for children. And you are a parent yourself,
Right.
and you know the challenges that families face, and you encourage parents to share their knowledge and experiences because a stronger community means healthier children.
Right. Absolutely. I think one of the things that I noticed once I became a parent is how many questions are out there about parenting, and how little answer there is out there about parenting. And I think,
Yeah.
like, starting actually as a conscious parent and a holistic parent, I want to call it, there is so many things that you have to become mindful about, that it becomes really, really overwhelming to be able to figure it all out by yourself. So one of the things that I really enjoy in my practice is, like, all of the moms and the dads, they're like, Dr. Sami, have you heard about this thing? Have you heard about that? It's like, oh, there's, I have a little store called a healing fairy store, and they come in and they're like, oh, make sure that, like, none of the vitamins, they have this ingredient, and have you noticed, like, about this other vitamin? So it becomes a perpetuating community that, like, you don't have to figure out everything all by yourself. You literally learn as you go through how to protect your child. And unfortunately, I think, as you and I know, like, our world, especially nutritionally, has become so deficient, and our soil and the way that we do our farming and the way that we go about our food and nutrition, it's so depleted that we have to be able to look at every single thing to protect our children, from the glyphosates to the dairy, to all the additives that they add to our food. I feel like it's a very different world than our parents, they parented us. We have to be so much more mindful. So that aspects of not just educating the parents, but the parents, it's staying humble enough where the parents start educating you. I think it's essential for all of the practitioners and doctors out there, because so often we just think we know it all and we have figured it all out, and we're the one who have gone to school. And then when you actually create a community, then the community learns together, and each one of us, we have a part that we teach one another. And it's so much more powerful than us trying to navigate through everything and having all the answers. So I feel
Yes.
like I've become a much better parent since I became a holistic practitioner, because I created that community where, like, during the Zoom, during the COVID, I started a lot of Zoom stuff, where we put like little pods together and started having all these classes together for kids, so they can still socialize within a smaller group. I started putting a lot of Zoom calls, in terms of educating them about what are some of the holistic ways that they can take care of themselves? What are some of the way that they can take care of their children? So I think all of that. And then the same thing, the parents would kind of come in like, oh yeah, I know this teacher, or I can offer this, and I can come and teach everyone how to make fermented sourdough, and I'll have that
Right.
just on the Zoom for everyone to offer. I can, teach you how to like make, we have a little farm. So how to make, goat yogurt, so get your goat milk, and then I'll teach everybody how to make goat yogurt. So it's a very, very sweet community of parents that I just feel so blessed to be able to serve in a much more profound way than just the teeth.
I love that. And community's been around for thousands of years.
Yes.
And that's how a lot of people got their knowledge, passed down through generations from their community members on how to raise children, for example, how to make sourdough. I know I have things passed down from my grandmother in Romania, how to make fermented sourdough, for example. Yeah. But
Yes.
I would love to know about your farm. What kind of things are you growing on your farm?
Sure. So the whole farm actually kind of came about again, like a little bit before COVID, but then fully in function by COVID. And part of it was I felt so disconnected, when I was looking at, okay, how could a virus do so much damage, and how could like it just shuts down the whole world? And I'm like a why kind of a person. I ask a lot of whys. And to me, like part of that, the why was the fact that we're so disconnected from our food source, and including, me, even though like, yes, I eat organic food, but then I go to a grocery store and I get all my stuff, or maximum go to a farmer's market and get all my stuff. But I didn't know anything about like how to grow your own food, how to have how to take care of chickens and quails and ducks, and we have sheep and goats, and then I have an organic garden. So I started kind of asking different people, and we started with like, I think 18 chicken that somebody needed to get rid of and brought it to our house. And then with 2 goats, and then 2 sheep. And then we started with like a few, vegetables and herbs. And so now it's just a full growing. It's like in 1 year, actually, we didn't know anything about birth control in sheep and goats. So in 1.5 years, I think we had like 25 goats and 30 sheep. It was just like every day there was 2 more, 3 more, 2 more, 3 more. It was very overwhelming at one point. So we started giving it away, and I started a farm school in my house. So it was 10 kids, and they were literally coming, and my daughter was part of it. We found like 3 amazing teachers that they would come in and they teach the kids how to milk the goats, how to make all kinds of different things out of that, and how to shear the sheep, how to dry it, how to basically like get the whole sheep wool completely with avocado seed oil kind of colored, and then how to spin it and how to make all kinds of stuff. Both my daughter and my son, they're quite handy, unlike me. They can make shirts and hats and socks and all kinds of stuff. And when I look at it, I wanted to see like, how can we prepare a different kind of future, not just for our children, but also prepare a different kind of a child that is much more in unity with Mother Earth and with everything else around. So both my kids, they know how to shear sheep. Both my kids, they know how to spin and, milk and make all kinds of stuff. They know how to garden. They know how to, when they go through, I had like a person that would take them hiking once a week, like the whole group of kids, and teach them like what are some of the herbal medicine that they were hiking, what did you use this one for, all the natural stuff. So just kind of creating a very, very different education that they're used to. And then applying all of these things. For example, like the math class was about making a coop. So all the kids, they had to learn measurements. They had to see like what's like the rectangular area and how much do they need per square inch, all of that stuff. So they applied all of these things into actual problems, and they built everything themselves, so they built a coop themselves. And it was
That's
very
amazing.
sweet to see that. Yeah, very sweet to see the skills that they're developing, that instead of sitting just in front of the computer or sitting just in a classroom setting, they're actually learning how to apply all of these skills into the real life situations.
Yeah, that's really amazing that you have that and you've implemented that in your household, because I think it's so critical, especially moving forward with the world that we live in, to learn these things and how to work and get things from the Mother Earth to
Right,
be able to sustain living.
right.
Yeah. And you also, together with your husband, you co-created a nonprofit organization
Yes,
called
love button.
Love Button Global
Is it upside
Movement.
down?
Okay. Tell us a little bit about that.
So both of us, we kind of were sitting one time and talking about what is the essential, while we were doing our master in spiritual psychology, what is the essential ingredients that it's missing in the world? And we looked at education, we looked at prisons, we looked at schools, we looked at hospitals, and we felt that every single place it's missing this ingredient called love. That's a hot commodity. It's used in a way that, the word is not used correctly. We just quite often we look at it as romantic love. But how much healing can actually be done from a teacher that really sees the child, really hears the child, really holds a space for the child. And the same thing goes into when, as a doctor, how often we're just too busy writing, and we never really look at this patient and really ask deeper questions. Like, okay, you have a mouthful of cavity. I had a mom a couple of days ago, and as I was examining the 1-year-old, 1.5-year-old child, I noticed that she had a tick, like she started like with a little bit of a tick. So, and I know that wasn't there before, so instead of like just focusing on the child, and the 1.5-year-old, and how can I, count her teeth and what is happening in her mouth, which already she's like sucking her thumb so badly, that everything is completely collapsing. All the teeth are already crowded, and she has a lot of anxiety at 1.5. So I looked at the mom and I said, "What's going on? Is everything okay?" And she's like, yes and no. I said, what's happening? Like, and I just kind of like asked one of my staff to just play with the child so I can take mom to the room. And then she kind of said, yes, we're going through a really bad divorce and it's been very stressful. And my husband and I, we used to do this thing where we helped our couple with conscious uncoupling, and we kind of wrote some articles about that. But we don't do that anymore. We like working with couples, but we don't do that as much anymore. But I was like, so I said, are you consciously uncoupling? It's like, no, it's far from consciously uncoupling. It's a very angry uncoupling. So I'm looking at this mom who's holding so much stress in her body and so much that is going on with her. And if I just treat the child and look at the teeth, I'm missing on the whole aspects of this matrix that the child is held. And I'm missing and then mom's like, she hasn't had a cleaning. She's been very busy. She's been very stressed out. And so it's an opportunity that gets missed in quite often as a healer. If you look at that and hold that space with love, so many beautiful things can nourish and can come. Like that mom just feels, oh my God, my holistic pediatric dentist or integrative orthodontics actually cares about how I feel, and how often we go to our pediatricians and they never, ever ask anything about us, and it's right, especially when you just give birth. Your OBGYN doesn't want to see you anymore, and your pediatrician is not really interested in you. So forget about you're depressed, you're overwhelmed, you're so, there's so much hormones going around. So that's when we started this course called Art of Loving. And for each group, it started something different. We've gone to medical schools and trained medical students. We've gone to prisoners and trained, prisoners. We've worked with with the foundation of Gustavo Dudamel and trained musicians, so we've done it like in different capacity and different ways, but it starts basically with wearing a button that says, I believe in this thing and I see you. And this is the conversation that I want to have with you, because everything else to me is just chit chat and useless, way, because if underneath it is not that loving and the whole conversation is not grounded with this universal language that we so brilliantly has been ingrained in us. And I really believe it's ingrained in us, because every time that I look at, I see a lot of babies, 5 to 7 babies a week. And every time that I look at their eyes, it's just like melt. I have never seen one baby that it's not just the eminence of loving. So I think somewhere we lose it, but we were already wired for it. So how can we get that conversation back, and how can we ground that in so many ways? So we've done a lot of different things, and we have a gratitude basket every year that we create, like these bags, for 1,000 bags for people in the homeless shelters or people in the temporary housing, women's housing. So we do different things, but they're all the same conversation.
Yeah, you bring up a good point about having the conversation as a healer with the patients, where they are. And especially as practitioners, people, that go to doctors who have to see a patient every 10 minutes. Yeah. There's no chance of establishing that connection and really understanding, okay, what is in the way for this patient? What is in the way that they're getting in the way of their own healing? Yeah. Because I have those patients. Right. Until they resolve some of their, personal problems, it's hard for them to go into a healing space.
Absolutely. Absolutely.
The love button. I'm going to have to get one of those for sure.
I'll send you some. I will make a note to send you some, to send you a gift package.
Thank you so much. I would love to join in this movement. I feel like I'm already there. So yeah,
absolutely. What you're doing with the show, I think it's already an eminence of the loving, because you're coming from your own time and your own effort, and you're putting all of these different resources, and just for having a conversation, having an education for people that they might not have the opportunity to have this conversation. So I think that that's already like your loving act and your loving contribution.
Yes, Sherry. And my mission is really to put holistic dentistry on the map as the mainstream. Yes. Because for the longest time, in dental school, we're just taught to drill and fill. Look at the tooth. Oh, it's got, okay, there's a whole fillet, just without thinking about the consequences that it might have on the whole human body. Right. So I think it's really time for a change in dentistry. Right. And that's like my big audacious goal, is to really put holistic dentistry, biological dentistry on the map, as to open up also the dentists who are listening to this podcast to understand that there is a way that's much more fulfilling for both you and I, and for the healer, for the practitioner, as well as for the patients.
Right. I remember that, I had a professor, God rest his soul, his name was Dr. Moss. He came up with the Moss hypothesis, and him and his wife, they had 3 doctoral degree, really, really intelligent. And he would scream in the thing. He's like, don't become a tooth carpenter. It doesn't take a genius to make a hole inside the tooth. You are doctors of the mouth. You should be able to take a look at somebody and know exactly how their teeth come together without even them opening the mouth. It was very interesting. It had such a profound effect on me. And especially because my husband is an osteopath, I kind of went further where I started looking at people like, oh, how does the jaw, what's happening with the neck, what's happening, how is the relationship between the neck and the sacrum, and, with the feet, it's like, it's so crazy. Like I just took an osteopathy course in feet. And
Nice.
do you know how many ligaments we have in our feet?
No idea.
107 ligaments just in one foot. So
Wow.
it's so phenomenal. And I was sitting with all these osteopaths and, 26 bones. And it's like, and he was talking about all these things. And then he looks at me, he's like, finally, an orthodontist is taking my course. So I said, he looks at me, he says, do you know if this bone is off because their foot kind of had like a little accident or just kind of slipped wrong and then the foot is off, it actually creates open bite because it pulls the whole sphenoid up and then it creates an open bite on this side of the body, Did
Wow.
you know that? And then like, this is what happens with like, if this bone is off in the cross bite of the body. So, and then he was explaining the whole relationship of it. And it was so interesting because I had this girl who has a lot of hyperlaxity of her joint and super flexibility. And it was almost 6 months that I was trying to close her bite, her open bite. She did myofunctional, she did cranial work, she did all kinds of stuff. And I don't use a lot of forces. I don't believe in a lot of forces. So I could like scratching my head, like, what's happening? Why can't I close the bite on that? Like, this girl has been in like almost a year in myofunctional therapy. It's not the tongue. And we have done all kinds of different things. So the next time she comes in, after this osteopathy course, I'm like, take off your shoes and your socks. And
I love it.
So I was like, stand over here. And sure enough, that bone was off. So I look at it, I was like,
wow.
Okay, well, I have a craniosacral therapist. Let me take you to her. And I went and I said, I want you to adjust this bone. Can you actually like get this one done? And she did have like a little slippage in, one day. And like, she's like, yeah, like my toe is kind of standing up since then. And I have a little bit of ankle, that hurts, from time to time, and it's uncomfortable. In 2 weeks, her bite was closed automatically, like on its own.
Wow.
So
that's unbelievable.
But how much do we not know, right? How much do we just kind of like think it's all here? And okay, let's get the tongue to work out. Let's do this. Let's fix this. Let's put an expander. And all of these things, they do work. But if we don't understand how this 22 bones and then the whole spine and the sacrum and the knees and the ankle and the feet, they're working together, as you kind of like, I was listening to some of your podcasts, and I love the fact that you were talking about like how the microbiome of the mouth, it actually starts kind of going into the knee, and the whole thing with the ozone and how you're kind of changing the biofilm of the knee. And this is like, they get some of the bacterias and things that this causes inflammation. So many people, they don't understand. And even physicians, that they are orthopedic surgeons, they are ENTs, they are they are extensively trained. They only understand one part. And because they understand one part, to me, and including me, and that's how I was, right? Because I only understood one part, then I was like this, the blind man, the 12 blind men touching one part of the elephant and think this is the whole elephant. And as I bring that curiosity and that enthusiasm to more like, how is the relationship between MTHFR and tongue ties? And what is the relationship of that with early premature birthing? And what happened with the cyst, and how I have another story. Can I share that with you?
Yes, of course.
So,
Absolutely.
I'm
You
a
have some really good
storyteller.
stories. I love it.
I had a mom with 7 kids, and she was basically, she came to me with the third one. By the time she only had the third one, so I had the blessing of treating her through all of these different pregnancies and her children. So every single child, like this tooth was out, like it was kind of like sticking out, right? And I'm looking at the parents and the grandparents, and it's like none of them, they have this tooth out. So I told her, I said, I have a crazy, crazy like hypothesis. Would you go with me? And she's like, yeah. I said, can you find out like the last part of your pregnancy, how, what does, I know you get, she got a kind of like polycystic ovarian syndrome. So your cysts, they start growing. Can you find out through the ultrasounds or through osteopathy, how does the child sit in comparison with those cysts? Sure enough, at the last part of her pregnancy, the last month, the cyst would start pushing and the child would sit in the same way in every single pregnancy and pushing on the face in that aspect. So the last 3, I said, and this might be a hypothesis, I don't know if it's true or not. I've only had one family like that. But the last part, I said, I want you to go and see a craniosacral therapist and an osteopath every single week. And then I also want you to wear a CGM monitor, like a glucose monitor, because I want to see how your glucose works, and really, really like monitor those cysts and everything and kind of change that. And then see an osteopath like once a week in the last month of your pregnancy, and get your child to be treated as soon as they come out by an osteopath. Sure. The last 3 kids, they didn't have that tooth sticking out. So
that's amazing. Wow.
Maybe by accident, but it's just, you kind of think about all of those things, right?
Yeah, it's important. And I remember myself, I took the osteopathy class, and I was trying to feel, the breathing in the back as you hold the head. But it's so amazing if you actually get to feel that movement. And
yeah, the first time it's so exciting. Yeah. You're like, wow, what do you mean
exactly.
The head moves?
Yeah, exactly. How do you incorporate osteopathy with orthodontics in the work that you do?
I have to say that I cannot do orthodontics without osteopathy. So I have a craniosacral therapist that's osteopathically trained in my office. So as you might know, I use the ALF, Dr. Nordstrom's advanced light wire functional appliance. I can feel myself, but she kind of goes beyond that a lot. So she treats the patient. I come in, I adjust the ALF with her, and she gives me feedback about the rest of the body, like, oh no, it's kind of like making the sphenoids rotate this way, or no, it's not doing really good for the shoulder. And then so we adjust that. Or sometimes I have osteopath that they treat the patient right before and then right after my ALF adjustments. And then if there is anything that it's not resonating with the rest of the body, they kind of like send me a note. Can you please adjust the ALF this way? Because it's kind of causing this, or it's exacerbating that. And so everything from orthodontics to, frenectomies, I don't know if I can ever do it without the osteopathic approach, because the body, it works so much together that, and then we have been, swore the oath of I do no harm. And I see when we do regular orthodontics without the rest of the body's concern, without looking at the rest of the body, we're just okay, let's put an expander, screw type expander, and just push everything this way. Okay, at what expense? Most of the time, patients are asymmetric. And when you're pushing equally on both sides, what happens is the side that was a little bit deficient doesn't move, and the side that was already moving moves too much. So you're creating a little bit of septal deviation. You're actually getting the vomer bone to deviate. You're getting the neck, the spine possible scoliosis, especially in patients now that I see with a lot of hyperlaxity and super flexibility of their joints, which I don't know why, but I feel like I'm seeing more and more of these patients. It's not the right thing for their body. So like that mindfulness about how are you expanding? And then you're not just expanding this way, but you can expand this way and this way. So like you're three-dimensionally and you're expanding asymmetrically, and you're looking at things with the airways and the postures and the spines and everything else. I feel it's it's our responsibility. I know we haven't been trained in it, unfortunately. But just like you, I hope that one day this will become like the normal way of looking at the whole body, and everything that we do in the mouth, it would be in support of the rest of the body, because from not only osteopathically aspects of it, but also neurosensory, and even I would say like our breath and our sympathetic, parasympathetic. There's so much that happens in the mouth that it's completely overlooked. And I feel like sometimes we're doing more damage than good by not knowing what we don't know. So
I agree. But let's go back to the ALF, because a lot of people that I talk to have no idea what an ALF appliance is. So tell us the difference between, let's say, traditional braces. And number one, do you still do traditional, braces with brackets and that? Okay.
I use
and
brackets, but not traditional. So
okay.
I don't do a traditional braces mechanism. So I use brackets for mindful movements of the teeth. I always stay in the light wires, and I always have an ALF in there, because I want to hold and support the cranium as I'm moving things. And I don't keep the braces for a long time, because if I'm obstructing the midline, I don't want that midline to be obstructed for a very long time, right? So I want that movement to happen. So yes.
That's a great point. And I do want to bring this up because I run into this midline obstruction with bridges, for adults that go across. So now we're talking about orthodontics. And I have patients that are really bothered by a lock that's cross arch.
Yes.
And some patients don't feel it at all. So what do you see in young patients when you have this midline that is now constricted with an arch wire?
So I think I think one of my patients actually kind of talked about it on, in an interview, and the interviewer, she's quite famous. So like the interviewer is like, what? This thing that the permanent retainer that you put, it affects your neck? And they were kind of like, frowning upon it. It is, because if things are not moving and it's just like one solid block, as you and I know, if like there is the cranial movement that happens with the cerebrospinal fluid going up and down. I mean, we're not just this one solid bone in the head. There's fluid dynamics that it's happening. So if we are like basically blocking everything and just kind of having it in one block, then it becomes at the expense of the neck, and it becomes at the expense of the nose, and it becomes at the expense of the spine, so many different things. So they might not notice that this is bothering. They might come to you and it's like, oh, my neck has been, bothering me for so long, or I have back pain, and they don't even know the relationship. But I can't tell you how many of my moms and dads that they came, was like, I don't know what to do with this. And I was like, okay, we're going to, if you're okay with it, that you understand that things, they might move, that's another conversation. If we are adjusting the teeth to one place that they have to wear a retainer in order to stay in that same place for the rest of their lives, to me, it's like you break your bone and you have to wear your cast every single night. So like your bones, they don't move. So something is not in that equation, hasn't been addressed, where the body naturally keeps the straight teeth in a place that it's harmonious to the rest of the body, and your tongue and your lips and your breathing and your posture is actually keeping your teeth, rather than like a retainer for the rest of your life, right? So we take that out and it's like, oh my God, I feel like I can breathe. And like my neck pain went away. Or like, I had these like recurrent sinus infections all the time, that went away. And so there's a lot of like subtle and yet profound things that happens with, some of those stuff that we kind of put forever inside the mouth. And especially in osteopathy, midline is critical. It's so, so important. So anything that crosses the midline and locks the body, it doesn't allow the body to just do and maneuver in the way that it's supposed to be doing it. So, and the
So
way
really, if everything's in harmony,
yeah,
once you straighten the bite and the teeth, it should stay there. Is it
yes,
without retention?
yes.
That's pretty incredible. So do you still have your patients wear retainers for a little while,
For
or?
a little bit, yeah. While they're kind of going through their growth and development, and while they're going through some of like, if they're playing sports, because when they get hit, things they change, if they are going through, like, if they're having habits like all the time like this, things they change. So I have them to wear it for a short period. And then I say, now it's going to be a really cute thing on the side of your bed. I don't want you to wear it every single night. I want you to wear it once in a while after a few months and just see how it is. And we're going to be looking at some of those functions and some of the things that it's not working. For example, when a patient goes through divorce and anxiety and trauma, and this was something, my patients are like my biggest teachers, right? So I had this girl that the mom kept coming and insisting, well, are you sure you don't want to put braces on her? Are you sure she doesn't need anything? I'm like, I'm 100% sure. Everything looks fantastic. Save your money, put it somewhere else, And she's like, but everybody has braces in her class. I said, yeah, but look at her. Her teeth look fantastic. Why would I want to put braces on it? Just,
Yeah.
you don't have to do. And then she went through COVID and I saw her after 2 years. All the teeth, and she was 14. So it wasn't like,
Wow.
so I saw her at 16 afterward. So it wasn't like she's still growing a lot. I mean, she was kind of like, she already had her cycle. She was already grown. All the permanent teeth were there. She went through COVID, and 2 years later, I'm seeing her, and all the teeth are crowded, like significantly crowded.
Wow.
And I'm like, what happened to you? Just, I don't know. I mean, it's just like I was noticing this, but so we kind of like did a little dig in, significant anxiety, sitting for hours and hours on her bed, slouched in to do her Zoom calls, as you and I
Wow.
know, beds are horrible because like the whole sacrum completely gets thrown off, and
Mhm.
then the rest and I always talk about like, this is one plane, this is one plane, your diaphragm is one plane, your sacrum, your knees, your ankle. These are all planes that they match with each other. They can't be
Yeah.
like one of them like this and then the other one doesn't get affected. So if one part of it gets affected, that's why I'm like looking at the whole body. Like if a shoulder is like this, I'm sure
Mhm.
you've seen that. What happens? Then there's tightness in the neck. Then it starts pulling the face from one side and it starts kind of developing very differently on one side than the other side. That's why they
Yeah.
say torticollis, babies with torticollis, do not release that tongue tie until you're actually, the baby has worked with an osteopath or a craniosacral therapist to treat that neck simultaneously. Otherwise, it reattaches on one side more than the other. So there's all these like subtleties that if you don't know, then we're just kind of looking at like, there's all these people, they just go in there and make these symmetrical tongue tie releases and they don't even look at the rest of the body. Some parts of it, they get reattached and you're like, okay, why did it get reattached? The patient go for 1 year through myofunctional and they went through this and they went through all of that. They did everything right, but the rest of the body wasn't really treated. And because of that, it kind of pulled it from one side.
Yeah. I love to talk about this osteopathic frenectomy concept because I was taught, as a periodontist, we have a tongue tie, go ahead, take a laser, a blade, whatever, and release it. We're just zooming in on the mouth. But how do you pull in osteopathy with that? And how early would you do a frenectomy on a child?
My youngest has been 3 days old.
Oh,
So
wow.
yes, so 3 days old. I think that's like my daughter was also 3 days old that I did her frenectomy. But it's the sooner you do it, actually, the better it is. And the easier, because they don't get acquainted with the wrong swallowing. Right. So because then they accommodate the swallowing, like our whole purpose is to survive. Right. So if the milk is not coming in the correct way, then like we just gonna accommodate with pinching the nipples, or like changing our neck, one breast more than the other, whatever it is that the baby does in order to be able to survive. So the sooner that you do it, the better it is, because you don't have to do all of those things. And then also when you do it as a baby, you don't need myofunctional, because the breastfeeding is the myofunctional. So, but the way that when you're looking at, like, I do not do the frenectomy without cranial work. So the person, like, I actually had a certain religious group that they say, we don't believe in any of these stuff. Like we don't believe in going to doctors. We don't believe in doing anything. The only reason is just because my baby cannot breastfeed, and we really want to breastfeed. We don't believe in formulas. We're here for you. But we would not do the craniosacral. I said, if I accept and do your frenectomy without that, I'm doing more harm, because then when actually asymmetrically it reattaches, then what happens? The tongue on one side goes up a little bit more than the other. So it starts forming the roof of the mouth a little bit differently. The palate is a little bit higher on one side than the other. Then what's above the palate? It's the sinuses. So the sinus, they start developing asymmetrically. What's above the sinuses? The eyes, they start developing asymmetrically. And then like the ears, they start becoming asymmetrically. It's all these consequences that happens that you kind of have caused in some ways, right? Because you release the tongue without really understanding everything else. The other thing that it's like, you said like the things that we don't want to talk about, but it's kind of like, I know a lot of people, they're going to disagree with me on this one, but I actually think that every time you have a tongue tie, you have a lip tie, because it's a midline issue. And there is no tongue tie without an upper lip tie. And unfortunately, the upper lip ties, they don't get released as much, because people, they cannot feel them osteopathically. If you feel a lip tie osteopathically, you see how it completely like pulls the whole midface, and it doesn't allow the midface to open up that much. So those are the kids that their turbinates are very big. They start, they kind of like when they breastfeed, they sound like that. They get sinus issues a lot. Some of them, they're like very serious looking, so just kind of like the eyebrows are very squinted, because of that. So I believe that every time that there is a tongue tie, there is a lip tie, and there's a lip tie. They might have different severity, but they're always come together. But when you're looking at that, and also like the sequence of things, what do you do first? I don't usually release everything all at the same time. I kind of look at like how the body opens up, and then there is a sequence. So if the tongue, like let's say you have an adult patient, and the palate is so small, like the whole, like all of the teeth are very congested. The tongue doesn't even have any space, like it's sitting on top of the teeth, and it has those lateral bordering, because it doesn't have space. If you release the tongue, it's going to get reattached. Or if the jaw is really far back, if you release the tongue, because it's still going to have all of that, just miraculously, things are not going to come forward after you release the tongue. So I always like address those before I actually release their tongue. So like those major stuff, I start expanding and making room for that tongue first. I start lowering down the palate so the tongue can actually feel the roof of the mouth. I start making sure that the jaw comes forward and there is lip closure before and there's no mouth breathing that it's happening. So these are some of the things that I make sure that I do before I actually release their tongue or upper lip. And it's actually my favorite thing. It's one of my favorite procedures to do. I
It
feel
makes absolute sense what you're saying in terms of checking everything
such a
else and create
difference.
the space.
It
Yeah.
makes such a difference. I mean, if you actually start studying fascia, it makes such a difference in the whole body. Like I had a mom that I just released her upper, and then she starts walking out and she's kind of like, like limping a little bit. And I'm like, why is she limping? And she takes out one shoes and she takes like a wedge out, about an inch out of her
My
shoes. And
gosh.
then she starts walking and she's like, and then the osteopath calls me. He's like, oh my God, I've been working on this hip for like 10 years and I couldn't stabilize it. What happened with like the release? It's the fascia that gets completely like pulled in one side, pulled in another side. I don't know if you've ever seen those videos of the way that the fascia actually constrict. I just had an opportunity to
Yeah.
go to Western University and like be in the anatomy lab. And it was so fun
Nice.
too, because at the time I did anatomy, nobody talked about fascia,
Yeah,
So,
we actually had a fascia expert on one of our shows recently.
oh, really?
Fascia, yeah, because it's so important. She
So
was talking
profound.
about how tight quads, the fascia being tight in the quads is going to cause PMJ problems.
Yes, absolutely.
Yeah,
Absolutely. Absolutely.
yeah, so
And
so
it's
important.
very
But
interesting.
first, we have a lot of moms that are listening, and they have young kids, newborns, and is there a way for them to kind of look at the tongue and see if they need, their children need help, like in terms of with this splenectomy?
Absolutely. So, first of all, actually go inside your child's mouth, like kind of put your finger, wash your hand, go cut your nails. Don't put those gel stuff. Otherwise, use a glove. So, and then
Yeah.
go underneath and like literally pull their lip and the side of their cheek and see how much space there is. And if does it feel like a little guitar string or like really tight, or no, it's soft, but you have to like pull the lip a little bit, and
Okay.
also sometimes on the upper lip, like because the tension is so much that you actually see the clefting. You actually see like this, so because it's pulling so much. Sometimes it goes all the way down. Those are the gummy kids that in the future they're gonna have a gummy smile. So kind of like get that first. Then when you're going underneath the breastfeeding, without a doubt, it's either the neck or the tongue. So you have to see if they have breastfeeding issues and they have mastitis, there is something wrong with the breastfeeding. So
Right.
most of the moms, they just blame themselves like, oh, I didn't have enough. I was one of those moms. This is how I got into it because 16 years ago, like I had a natural birth and I wanted to breastfeed. And then no matter how much 17 lactation consultants and pediatricians and all kinds of different people, they're like, oh, no, maybe like, you don't have enough milk. Maybe you don't have, maybe there's this, maybe that, maybe like one pediatrician is like, maybe you're not spending enough time with your son because you're a working mom and he's punishing you for not doing that. It's like, so bad advice. But once actually Dr. Nordstrom, the inventor of the ALF, he came in, it's like, no, he has a posterior tongue tie. As a UCLA professor, I had no idea what that was. I mean, I had never heard of it. Yes, ankylosing, but what's the posterior tongue tie? Posterior ankylosing. It's when the tongue cannot lift up. So they still stick their tongue out, but the back of the tongue doesn't lift up. So those are the kids that they turn into the Mallampati score 4, 3, right? Like that means like you can't see the back of their throat after a while, or they start getting really large tonsils and then they start becoming mouth breathers and then and they wake up and they come to your bed at 2:00 in the morning every night. And, and then there's kind of sequences of all of these things that happens. One thing that I really want to emphasize, if just because you were able to breastfeed, that does not mean that your child doesn't have a tongue tie, lip tie. If you were one of those mothers that had a lot of milk, the child starts actually drinking out of the breast, kind of like almost like a bottle. So instead of using these cheek muscles, they start using the mentalis and the masseter muscle. So it's very different. Like the bottle feeding is a very different muscle usage than the breastfeeding muscles. So just because you, oh yes, I breastfed until 3 years old, that does not mean that your child didn't have a tongue tie and lip tie. And then go to someone and check with someone that understands the whole aspects, because a lot of pediatricians, they don't know. They think only if it's stuck at the tip of the mouth is the tongue tie, and they miss it. Most people, they don't know how to look at the upper, like they don't even look at it. And then I think the buccal ties are completely missed, because we have 7, frenoms.
Yeah.
I don't usually, I very, very infrequently end up, doing the buccal ties. By the time that I actually get the midline corrected, maybe one of them, if it's kind of creating like that side of the face is not opening up, but most of the time, it just kind of like with osteopathy and cranial work, they start opening up. But just learn how to look inside, go underneath the tongue. Can you, lift up the tongue in the back part or no? So being in your child's mouth, it's really, really important, so you can understand some of those things.
Yeah, that is so important because it does affect later on also breathing and airway, sleep and everything.
ADHD, they label it as ADHD, but a lot of times, when the child is not sleeping, they exhibit symptoms just like ADHD, so they can't sit still, they are disruptive, they can't focus. You and I, we know, when we weren't sleeping because we were waking up every 2 hours breastfeeding, you're not a very nice person. You can't be very focused and sitting and really paying attention to learn anything because you're just so tired. Your body's so tired. These children, they are, they never go to deep sleep a lot of times because the tongue goes into the back of the mouth. They mouth breathe, when they're mouth breathing, it goes to the back of the mouth. And then since they can't breathe, it keeps waking them up from the deep sleep. So these are the things that it gets missed, unfortunately, a lot. Or they hire someone that they sleep training. And if the sleep trainer doesn't know anything about these things, now you're creating actual trauma for the rest of their life in the child because it doesn't matter how much I'm going to cry, nobody's going to come to help me out. So those are the aspects of it that's okay, if you're having someone that's sleep training, first understand the whole body and make sure there's no issues. And then after that, kind of to go and create some kind of a structure that would support the whole family, but not in a way that you're putting a 3-month-old already in another room and just making them cry out. And then you're missing the airways or you're missing some aspects of things.
Yeah, absolutely. Makes sense. Wow, Dr. Sami, you've given us such amazing information about how everything's connected. Amazing talking to you. I get
really enthusiastic. So
where can people find you? Where is your practice?
My practice is in Agoura Hills, which is north of Los Angeles. It's a little, for the people that they're in the west side, they feel it's far, but it's not. And it's lovely to be able to see the hills. And so I have a lot of my patients, they actually travel to get to me. But yeah, it's in Agoura Hills. And my husband and I, we actually have a practice together that's like a freestanding. He's a osteopath, so he's on one side and I'm on the other side. And we have a lot of incredible practitioners that they support us, from acupuncturists to myofunctional therapists, breathing re-educators, for him, massage therapists, nutritionists, so we have a group of people that they're incredible and we get to learn from them and support our patients with them.
Wow, that's like a dream practice for sure, to have everybody to work together.
Thank you.
What's the website? What's your website?
Happy Kids Dental Planet.
Okay, we're going to put that down in our show notes as well. Happy Kids Dental Planet. I think it's amazing what you do, and how you develop this practice. It's like a dream come true.
You as well. I'm so impressed, and thank you so much for everything that you do. So grateful for that.
Oh, yes, my pleasure. Okay, well, with that, we conclude our show, and we look forward to have you again and have another conversation. I'm sure there's so many things I could talk to you about.
Absolutely.
All right.
It's a pleasure.
Please make sure you check out the show notes for any links mentioned in the show. Do you have a question you'd like me to answer? Message me on Instagram at Dr. Sanda. This is Dr. Sanda, and remember, your mouth is the gateway to your health, so take care of it in the most natural and best way possible.